This is Mountain Health Minutes. I'm your host, Ted Owens, and my guest today is Dr. Briner Evans, Chief Medical Officer of the Tahoe Forest Health System. Dr. Evans, very good to have you here with us today.
Thank you, Ted.
Dr. Evans, something that's been in the press and the media now for several years, but very prevalent today, is artificial intelligence, AI. Can you bring us into the world of AI and what it means in the healthcare profession?
Oh my gosh, this is a huge topic and one I could talk about for a long time, Ted. So it's a great one. People should know that artificial intelligence is already in use in healthcare internationally. It's very much used in certain areas like radiology. Artificial intelligence systems can read certain studies for certain kinds of diagnoses, and that capability is only expanding and expanding very rapidly. There's artificial intelligence programs now that are able to act like a virtual scribe. So they create a medical document for a physician or another clinician automatically, and they do this very, very well, and they're getting better all the time. They're also doing things like analyzing our medical records and making sure that we're up to date on everything we should have, from screening examinations to making sure that our diabetes is under control. So it really is remarkable what these systems are already able to do. But what's amazing is what's going to happen next, because there's not a person alive right now that knows exactly what it's going to look like in even 10 years with the artificial intelligence advancements that are happening so rapidly.
Now, some of them can be very helpful. For example, I know the keeping of electronic medical health records became an issue for physicians trying to see a patient, trying to data input at the same time. So in some ways, AI can let them get back to doing what they love, and that's seeing a patient, right?
That's right, and we're already using that here at Tahoe Forest. So we're piloting and are going to roll out an expansion of that particular service. So what it really allows is for our physicians and other providers to be able to talk to their patients and really focus on the patient as opposed to focus on documenting and typing or dictating and those types of things. And so if their charting is done automatically and it's done at a very high quality level, then it really improves the experience of the patient. You can cover more territory with them. And it's really a better situation for the patients and the providers. So very excited about that technology. And like I said, it's just getting better all the time.
In our remaining seconds, Dr. Evans, AI may replace some work that human beings do in the clinical realm, right?
Well, at this point, we're really looking at it as an adjunct to what clinicians are able to do and other healthcare providers are able to do. But like I said, things are evolving rapidly, and there is there's really no way to know exactly how AI is going to be leveraged in the future. But we're looking to enhance human productivity and performance as opposed to replacing people.
Thank you very much, Dr. Evans. This is Mountain Health Minutes. The folks at home, thank you very much for listening.